One of, I think, the plaguing questions for a lot of people is how to heal from the trauma of being in narcissistic type relationships. And one of the things that people call me about, one of the things that people come to me about is that they're seeking help or they're seeking some sort of advice in terms of how to navigate their relationship with a narcissist or borderline. Usually what I run into the most in that regard are codependent, caretaking type men who are in a relationship with someone else borderline. And they often call me and they want something specific, specifically how to magically fix their relationship or tell them exactly the perfect thing to do in order to fix their relationship. But this is exactly the type of thinking that causes the trauma. This idea that there's a perfect fix. This person usually gets into the mode of thinking that everything is their fault. Now, there's kind of a greater dynamic here because a kid can grow up in that environment where they might have a narcissistic type parent that never takes accountability, never takes responsibility, blames everyone, including the children, for everything that goes wrong. And so that child actually grows up believing that A, it's their fault, 100% their fault anytime anything goes wrong, and B, 100% their responsibility to fix it. Ooh, good coffee this morning. So good. And before I kind of get more into this, if you like my content, you know what to do. Like, subscribe, share, comment, all that stuff. And it would really help me out if you hit the tip jar. All the links are in the description below. If you are a viewer and you have a question about personality disorders, parenting, teenagers, especially parenting teenagers, trying to co-parent with a high conflict type, family court, that type of stuff, you can find my email down below in the description. And again, it would really help me out a lot to hit that tip jar and really enable me to keep this kind of content going. So let's get back into this, okay? So here you are, right? And if you get into one of these relationships, what I find is the folks that they cling to these relationships. They're so enmeshed they can't see past it. Usually once they get around the bend of seeing how toxic and heinous it was and how grateful they are that they're not in it anymore, that's when they have a little bit more objectivity. But usually when they're in the relationship, it's extremely difficult to help them. I mean, I had one guy call me once, why should I hire, my wife is BPD, borderline, and why should I hire you? And I'm like, well, you probably shouldn't. Because quite frankly, this is not, I do a lot of different types of work. My passion is empowering teens, working with struggling teens and empowering them, making a difference in their lives and healing families. The thing that does not get me out of bed in the morning is trying to convince you that I can somehow magically fix your super enmeshed codependent relationship. All that being said, again, once they're out of it, it's like that clearly has been a traumatic relationship because they are still entrenched in a lot of that thinking. They're still entrenched. It's very problematically. It's very problematic where it's like even though they might be even years removed from that marriage or that relationship, the relationship still controls their behavior day in and day out. So that would be considered trauma. Clinically, that is considered trauma because their behavior is still controlled by their ex, even though they're divorced or whatever, right? So we have to fix this. Now, I'm going to come at this from a couple of different angles because, quite frankly, there's not a lot of information out there on this. There are books, but it's like there's kind of the core parts of the clinical world, right? In terms of anxiety, depression, PTSD, bipolar, schizophrenia, that type of stuff. And then you kind of get a little bit more fringy just in terms of clinical focus. And the more fringy you get, the less clinical information there is on studying this stuff and figuring out exactly what works. There are books out there on healing the trauma, separating yourself mentally from those situations. Here's my thing. is if for those folks who have been in those relationships where they are, you know, they were married or whatever to one of these folks, and it had just kind of decimated their self-esteem and their sense of self and their identity. The longer you're with them, by the way, the more you can expect to just find yourself without any sense of self or sense of identity. And that's traumatic. It just is. Those relationships are just traumatic. So my thing is, like, you know, I see these guys, they just cling to it. It's like the longer you cling to this clearly toxic relationship, the more difficult it's going to be to correct this and heal this later on. They don't listen. Sorry, I'm I digressed there. So, but my answer is your goal, your purpose, your reason for getting out of bed in the morning is to heal this trauma, because it's going to ripple affect your entire life. It's going to ripple affect your current relationship, your job, your family, your self-esteem, your motivation, your identity, your parenting, everything. And I talk about this all the time. If you're in these high conflict situations, your focus needs to be self-care. And everyone always looks at me like I'm crazy. I'm gonna keep beating on this drum. It's so important that your first priority, and that doesn't mean that you don't have other priorities. It doesn't mean that your attention is divided elsewhere. Is to learn how to change your mindset on the situation and start healing the trauma. So how do you go doing that? So the therapy model du jour right now is EMDR. Most people have heard of EMDR. Quite frankly, in the clinical world, there's some controversy around it. There are clinicians that don't love it. I happen to be one of them. Now, I have seen EMDR done well. I actually have a clinician that works for me right now. She does it really well, and I think it's great. And I'm super happy with the outcomes that she gets in terms of her EMDR practice. She does it really well, and when it's done poorly, it's not good. And this is one of my beefs with EMDR. The other one being that it tends to be a one-size-fits-all fit, that people get into their head that regardless of whatever mental health issue they're having, they need EMDR. It's just not true. There's lots of really effective therapy modalities. I believe that I'm very effective as a therapist, that I can get results with people pretty quickly. I don't use EMDR. I use a whole bunch of other smattering of modalities, and I kind of mix the methods. But for people with trauma, they're seeking EMDR. Quite frankly, it's hard to find a good EMDR therapist. B, if it's done poorly, it's not really going to help. It's a very complex therapy model, and it's often done poorly. Those are just the facts. Okay. EMDR also, it's hard to pin down a good EMDR therapist. The other thing I dislike about EMDR, you can't use these tools for yourself. Virtually all the other therapy models, CBT, trauma-focused CBT, DBT, and a lot of these others, lifespan integration, one of the ones that I like TFCBT, which is trauma-focused cognitive behavioral therapy. I like reparenting. I like lifespan integration. You can learn this stuff on your own and do it for yourself. You can learn these tools and work on them yourself. Obviously, it's more effective to do it with the help of a skilled therapist, but you can empower yourself. You can educate yourself. You can dive neck deep in any of these other modalities and learn some of these tools yourself and use them day in and day out by reading books or watching YouTube videos on them or listening to podcasts or whatever. EMDR does not come with that luxury. It's so complex and kind of abstract that it's very difficult for people to be able to empower themselves. As a therapist, I believe that everyone has a right to empower themselves. Everyone has the right to educate themselves, to do their own work. They do not need my permission. I was working with a young man yesterday, and starting to get some traction with him in terms of being able to empower himself, being able to educate himself. And I gave him an exercise to do, some therapy homework, and he asked me a great question. He says, well, what if I confront my beliefs and I decide that I need more action to take? That I need to take more action? And I said, well, then absolutely do it. You do not need my permission to empower yourself, ever. or anyone else's permission to empower yourself for that matter, ever. And so when you're healing this trauma, the trick is, first of all, to calm your limbic system. Now, if you have, I talk about this all the time, if you have an overactive limbic system, it's going to be very, very difficult. You can tell if your limbic system is overactive if it's ruminating, if it's just cycling through, if it's trying to make sense of things that don't make sense. That's how you know your limbic system is overactive. You need to calm it. So me as a therapist, I always encourage people to meditate. Meditation is a very, very powerful tool for calming the limbic system in the middle brain and putting your thinking brain in charge. Meditation is supported by research. It is considered part of positive psychology. Meditation is a very, very powerful tool for doing this. So if you ask me, if you really want to heal the trauma of this, dive deep, just do a deep dive in educating yourself. Read the books, listen to the podcast, watch the YouTube videos. You know, it's easy to get onto YouTube and start looking up the regular BS or nonsense that you're accustomed to, when you can find many, many videos and lots of information on educating yourself on this stuff. Make those personal breakthroughs. Read the books. Work with a therapist on processing things. Incorporate meditation. The trick is, too, if you ask me, you have to develop a new self of sorts. You have to create a new identity. You have to detach yourself to a new version of yourself and detach from the old version of yourself. But I'm also pulling a page from the book of Dr. Joe Dispenza right there. He wrote a book called, he's written a few books, my favorite being called You Are the Placebo. And he talks about how, you know, even with your health issues, you have this attachment to the old self. And you're living an old story, and it affects you today. So those are some of my thoughts on healing the trauma from a narcissistic relationship. Thanks again for watching. I gotta go to the office. I gotta go do a couple of job interviews. Thanks again. We'll see you next time.